Welcome to our discussion on premature ejaculation, PE. Premature ejaculation, PE, is a common sexual dysfunction characterized by the uncontrollable ejaculation that typically occurs with minimal sexual stimulation, often before or shortly after penetration, causing distress or interpersonal difficulty. It can lead to various psychological issues, including a significant impact on self-esteem. Definition: premature ejaculation refers to the persistent or recurrent ejaculation with minimal sexual stimulation before, on, or shortly after penetration, and before the person wishes it, which causes marked distress or interpersonal difficulty. Symptoms: symptoms of premature ejaculation include ejaculation consistently occurring within 1 minute of penetration, inability to delay ejaculation during intercourse, feelings of frustration, embarrassment, or guilt, avoidance of sexual intimacy due to fear of premature ejaculation, relationship stress or strain due to unsatisfactory sexual experiences. Causes: premature ejaculation can have both psychological and biological causes. Psychological factors may include performance anxiety, stress, guilt, or relationship problems. Biological factors such as abnormal hormone levels, thyroid problems, or genetic predispositions can contribute. Certain medications, substance abuse, or underlying health conditions may also play a role. Rebuilding confidence after premature ejaculation. Strategies to rebuild confidence may include communication with a partner, seeking professional help, and exploring relaxation techniques or behavioral therapies. Overcoming insecurities due to premature ejaculation. Addressing insecurities involves understanding the root causes, seeking support from a therapist or counselor, and practicing techniques to manage anxiety and negative thoughts. Boosting self-esteem in intimate relationships. Building self-esteem in relationships involves fostering open communication, mutual respect, and understanding. It may also include exploring intimacy beyond sexual performance. Coping strategies for self-esteem issues. Coping strategies may include mindfulness practices, cognitive behavioral techniques, and self-care activities to promote overall well-being and confidence. Building self-worth after premature ejaculation. Building self-worth involves recognizing individual strengths, setting realistic expectations, and seeking support from loved ones or professionals. Overcoming shame and guilt. Overcoming shame and guilt requires self-compassion, reframing negative thoughts, and addressing underlying issues through therapy or support groups. Positive mindset after premature ejaculation. Cultivating a positive mindset involves focusing on personal growth, practicing self-acceptance, and embracing holistic approaches to sexual health, such as Ayurvedic treatments offered at True Power International Sexologist Clinic. Male sexual health and self-esteem. Male sexual health and self-esteem are interconnected, and addressing sexual concerns like premature ejaculation can positively impact overall well-being and confidence. True Power International Sexologist Clinic. True Power International Sexologist Clinic offers specialized treatments and support for individuals experiencing sexual health issues, including premature ejaculation, with a focus on holistic approaches and Ayurvedic remedies. In summary, premature ejaculation can significantly impact self-esteem and intimate relationships, but with the right strategies, support, and treatment options, individuals can overcome insecurities and build confidence in their sexual health and overall well-being. Thanks for the watching.